Welcome to MISSIO. This streaming series will help us navigate today's challenges. It's a service of the Pontifical Mission Societies. I'm Don McCrabb, Executive Director of the United States Catholic Mission Association. It's my pleasure to introduce you to Dr. Richard Byrd, who is our guest tonight. Richard, welcome.
Good evening.
It's so good that you're able to be with us. We have a big topic to address tonight, this question of the COVID fatigue. But before we get into that, Richard, would you take a moment just to tell us who you are and where you serve?
Certainly. I'm a pediatrician just outside of Houston, Texas. My office is in Missouri City, Texas, just southwest of Houston. Been practicing in that area for about 36 years now, and involved with missions for about 20 years, since the year 2000. And I kind of like to tell the story of how I got involved with mission. My oldest daughter, who's now 40, was 17 at the time, and she took a trip to Uganda on a medical mission with one of my colleagues, and that impressed me a whole lot. The 17-year-old going on a mission to Central Africa. And so I thought, wow, if my daughter can do that at age 17, I should be able to do that too. So I kind of followed her example and have been hooked on doing it. And she's actually been able to come back with me on a couple of missions too, which has been very nice, because she is also a pediatrician.
Oh, wow. So your daughter, 17, she went on a medical mission trip, got you hooked, and now she's a pediatrician as well, and also going on mission trips. So it's become kind of a family affair. That's a wonderful story. I know that you have a few photographs about medical missions. I don't know how much our viewers know about medical mission. I'd like to welcome all of our viewers tonight. Please feel free to let us know who you are and where you're from in the chat box on YouTube. But Richard, if you would just, we're going to show these slides. What are we going to see here?
This is some pictures of our trip to Costa Rica to work with some of the indigenous people, the Quebecer Indians. And the first slide was a outdoor prayer meeting that the mission group have, and we were having mass in the morning there. And there's a group of pediatricians working with patients, and that's our pediatric team there.
Now, you go down with, including. I'm sorry, you go down with a team, huh?
Yeah, we take probably 30 or so people when we go to Costa Rica. We have dental services, medical services, chiropractic, physical therapy, vision therapy, help people restore their vision with glasses. And when we also take a trip once a year to Laredo in Texas and work in some of the colonias on our side of the Rio Grande. And sometimes we take a team of 40 people down there and provide similar services, as well as spiritual counseling.
Wow, that's really very impressive. And how long have you been doing these medical mission trips?
Well, for 20 years, since the year 2000, although we canceled both of our mission trips this year because of the COVID pandemic. Costa Rica was having restrictions on flights, and sure. We normally go there in April, and that was the worst time I think all the airlines were kind of shut down in April anyway. And then when normally we go to Laredo this time of year in November, but they were having some extra cases down there, and it's a big group that we take down there, and we bring a lot of people into a small area, so we didn't want to, in consultation with Catholic Charities who we work with and the bishop down there, we decided not to become a super spreader event by having a medical mission.
Right.
Our hearts are there right now, though, because this is when we would be there.
Sure. Well, we certainly appreciate that, and a lot of missionaries are experiencing the same kind of thing, feeling that distance because of the COVID-19 pandemic, which leads me, of course, to that question. I'm sure that you've had quite a bit of experience with the COVID-19. Could you just share a little bit about your experience of the pandemic? How have you been personally and professionally impacted by this pandemic?
Certainly. Well, personally, my immediate family has been spared any any infections with COVID, but we take a lot of precautions too. We're trying to stay at home as much as possible and not gather in large groups. And of course, at work, I'm wearing PPE when I see my patients so I don't bring anything home. And of course, clean up good when I get home. But the pandemic has kind of had I think a couple of phases. It seemed like in our area, the elderly were the most affected initially, and had the majority of the hospitalizations were in the elderly, and loss of life was in the elderly as well. And now we're seeing more infections in sort of the middle-aged and younger people, late teens, early 20s and 30s. And they're not getting as sick as the elderly because they don't have as many comorbid conditions, but there's still the risk that they could spread that to other family members that do have pre-existing conditions that would put them at more risk. And of course, there's the children, which I see. Fortunately, we haven't had a lot of children test positive. We have had some. Personally, I haven't had anybody in the hospital with COVID. My partner just had a 2-week-old hospitalized recently, but did quite well and came out just in a couple of days. But I mean, with a 2-week-old, you got to be very careful and
Sure.
probably more precaution than anything else. But most of our patients in the pediatric age group have overall done very well, and it's mainly it's more in the older ones. The younger ones, the infants and toddlers and preschool age kids have had less disease than the, say, middle school and high school students. They're the ones more likely to test positive in my experience here.
One of the things that we wanted to talk about tonight is this concept of the COVID fatigue. It's been interesting that it's really being written about. I actually stumbled across an article in the Wall Street Journal about this. How do you understand that expression from a medical perspective? What is COVID fatigue?
Well, I mean, fatigue can certainly be a symptom of the disease itself, but of course, we see many more symptoms than just fatigue, especially fever and cough are some of the more prominent symptoms. And there are many other symptoms as well, many respiratory symptoms and loss of taste, loss of smell. But I think now we're all thinking that COVID fatigue is really what the entire population is experiencing as we go into the second 6 months of this pandemic and various degrees of lockdown in different parts of the country, and just not being able to do our normal things that we enjoy doing and getting to see the people that we want to see. We're becoming fatigued and tired and worn out by all this, and it's hard to see where the end is in sight. Hopefully there's some hope coming soon with a vaccine, but we're also worried what the winter's going to look like as people spend more time indoors and less time outdoors.
Well, do you have any ideas or suggestions as to how do we get a handle on this fatigue that we begin to experience? As you said, we're going into the second 6 months of this pandemic.
Yeah. Well, I think it's probably helpful to keep up the regular routines that you can do. I mean, for me, I start each day with prayer, and that's always helped me no matter what stage of my life I'm in. So I'm not skipping out on that now. And with less time to travel, I've actually found more time to exercise, and I think that's been helpful too. Taking care of my own self a little bit more. Next thing I got to do is start eating a little better, but I'll save that for phase 3. But
yeah,
I do think it's important to keep prayer in our lives, and it's different attending Mass now because many of the services are virtual. But I love staying connected with my church family as well, whether in person or virtually. And our mission team too. Even though we're not going on mission, we're still sort of meeting virtually every so often, and it's good to see everybody and talk to them. And so it helps us stay connected with our friends in mission, because for most of us that's our very dear and close second family, our missionaries.
One of the things that you didn't mention about was just rest, sleep. What would you suggest about that?
Well, that's very That's very important, probably because I talk about it every day to my patients about the amount of sleep that they need to get. But I think the whole world can be sleep deprived, and sometimes we can have anxieties that we're thinking about, whether it's just the COVID fatigue or the political situation in our country. All these things they've kept me awake at night. I have to admit it. So trying to get more rest and taking some strategic naps, as we call it in the medical field, when you can, is also a good idea.
Well, I want to probe that a little bit, but before I do that, just want to encourage our viewers to give us some questions in the chat box on the YouTube channel that you're watching us on, so we can engage Richard here. So, talking about naps, you said that what strategic naps? Could you talk a little bit more about that? I think sometimes I find like the idea of taking a nap is like, wait a second, I'm not supposed to do that. I have to work 8 hours, that kind of a thing.
Well, I'm an old guy, so I appreciate strategic nap might be just if you've got 10 minutes to close your eyes at lunchtime and got most of your work caught up, then I'll try that. And that's sometimes just 10 minutes can be quite restful.
10 minutes. So everybody now has a doctor's permission to take a 10-minute nap in the afternoon.
Exactly.
So that's excellent. Very good. Excellent.
I do worry that some people may come by my office and see me staring at the screensaver and wondering what I'm doing. My head is nodding there, but because usually I'm too tired to get up and close the door. So the whole world knows I'm taking a nap, I think.
Right. So you were talking about the importance of prayer for you as one way of navigating this fatigue that we're having. Could you say a little bit more about that? Do you set up a certain time? Those kind of questions.
Well, I mean, I do mean when I say it's the first thing I do every morning. I mean, I get up and make myself a cup of coffee and sit down and go through my Christian book of prayer, that the same one the priests and the deacons use, and do the daily prayers that are there. And I've found that I've been doing that for probably 20 years as well, and I found that to be a wonderful way to start your day. And so it always gets me started off in the right direction, on the right foot, to start with prayer.
That's great. We do have a question from Al. He's following up on the question of the nap as well. Is there an ideal length of a nap? And what about the ideal number of hours to sleep at night?
Well, for the second question first, I think we'd like adults to get 7 to 8 hours of sleep every night. And as far as I think the amount of time for a nap might vary from person to person. Like say, some people can feel rested after 10 minutes. Some people, it might be 20 or 30 minutes that they need, but probably nothing more than that. I think if you're trying to get a nap during your workday, I wouldn't want to push it more than 30 minutes.
That's great. Yeah. One follow-up question from Al. He was just curious, are you praying the entire daily office in the morning?
Yes.
Well, very good. One question from Jake was, how do you think we can keep people interested in attending Mass, even with all these restrictions that the pandemic has imposed upon us? Any ideas on that?
Well, I'm sure the liturgists have plenty of ideas there, and I'm not a liturgist, but I mean, our church does a very good job with the recordings, and I actually look forward to them eagerly each weekend. I mean, we are letting a limited number of people back into church. We're backed up to about a third of our capacity. Our sanctuary seats 1,500 people, so it's a lot of people. Even a third of that is a lot of people. And it is indoors, so I mean, a lot of people are still trying to be careful and stay away. But and there are other. I mean, I've looked at some of the other church services that are available. A lot of them are streaming live, and it's kind of fun just to look and pop into a different church sometime and see what's going on in a different part of the country. But I do love my home church.
Right. Sure. Yeah. Yeah. I certainly understand that. Um, One question that Jenny has asked is, how are the parents of the children you see dealing with the fatigue of the COVID?
Well, I say that I think the young adults are the group that it's hardest on right now. Many of them are either underemployed or out of work or working from home, and they have their kids at home often that are doing virtual learning from home. So they have to help their kids with that, and they have to get their own work done. And I think our young adults are the ones that probably need the most support. I mean, for some parents, the answer is if they have an option, I'm going to send my kids back to school because I've been doing this for 3 months and it's wearing me out. And sometimes by then the kids are ready too, and the parents have decided that the community infection rate is pretty low, and they're willing to take a risk on that.
We have, I have a neighbor who kind of fits that description. And one of the things they've tried to do is they try to kind of do two things at one time. So they have a play date. One of the neighbor kids comes down and visits. They play outside on the front porch. That's where they're limited to. So they're outside, they're on their front porch. They're two young girls. And so they're kind of creating these little cities with all of their different toys. But they give it, they're involved for about an hour, which is good for the kids and good for the parents because they get a bit of a break. Um, One of the questions that Jake has asked is about your mission trip experience. Um, does your mission trip experience help you in dealing with the COVID in a general and the fatigue? How?
Well, I think it helps me with life in a general way. I mean, whenever you're helping the less fortunate and you come back to your own reality, I mean, you see everything that we take for granted when you're there. Because a lot of times these people don't even have the basic necessities that we have. So I think it helps keep everything in perspective for you that we are very fortunate, even if we're locking down and not able to go to a restaurant or eat out or go to a social event or gather in large groups, but we still have a lot of blessings that we sometimes, like I say, take for granted. And so mission helps me with that. I mean, it helps me keep that. I think about that a lot. Normally I think, man, we'd be down there right now working in the Laredo area, but we miss our friends down there we work with too. But at the same time, we're fortunate to live where we live.
Right. When you go to Laredo, how many people would you see in a typical mission trip?
Probably, we usually work from like all day Monday through lunchtime on Friday, noon on Friday, then we pack up. So probably, somewhere around 750 people a week, sometimes a little bit more, sometimes a little bit less, but somewhere around 750 people a week would come in for services. And
Wow.
sometimes those people would receive multiple services from us too. They might go to the dental clinic as well as get their eyes checked and get checked
Sure.
out by one of our physicians as well.
And then would that be similar when you go to Costa Rica, or is that different?
It's very similar. Now we do kind of partner with the local health department down there, and sometimes we'll partner. We can get some local dentists to come and help us as well, which is very nice. But yeah, we've got a very pleased with the setup we have in Costa Rica. We actually use the health department's formulary for our medications, and
Oh, good.
so they bring the medications and we write the prescriptions, and then they fill them for us. And I guess we're doing an okay job. We work off their formulary. We're not trying to be wasteful of anything. But that's a very ideal situation. And other times you have to take everything with you that you're going to prescribe. And we used to do that on our trips. We used to take some trips years ago deep into Mexico, drive into Mexico pretty far, maybe 12 hours from the border. And we would
Hmm.
just take everything with us when we went on those trips. And that was expensive. And it's much better to be able to partner with somebody locally. And we're glad that the health department in Costa Rica allows us to do that.
Right. Uh, Trying to dig down a little bit deeper on the question of fatigue, Kendra has asked the question, can you give us ideas to determine if one might be fatigued? You were saying earlier that fatigue could be one symptom of it, but it's one of multiple symptoms. If you're just tired, that doesn't necessarily mean you have the COVID. Or did I misunderstand that?
No, I think you're right. I mean, certainly being tired can be a symptom that go along with other symptoms of COVID-19 disease. And some people get very tired with it, of course, and it takes them a long time to get their energy back. So, but again, there's other symptoms involved. Usually there's some respiratory symptoms, and initially could be some fever, of course, too. So I think if you have other symptoms along with your extreme fatigue, then that's definitely worth checking out to make sure you don't have an infection from COVID-19.
Right, right. And if a person is just, they wake up in the morning and they're feeling fatigued, any thoughts about what they should do?
Well, make sure you get enough sleep at night, and hydrate well. Eat some food. Don't neglect your self-care, and try to get some rest. If you're able to do that, get some rest. Like I say, it's hard for these young parents, I think, that are struggling with this right now to get enough rest. I mean, some of these parents, they wait for their kids to go to bed and then they do their work. So they're working, past midnight sometimes with their jobs because they had to help their children during the daytime. So it is tough. It's hard. It's very hard.
Kendra has followed up with that question, and she says that she's thinking more of the emotional and physical fatigue of just being homebound. Any thoughts on that
Yeah.
one?
Well, certainly, and I say some of my families have gotten pretty creative, and they're doing more outdoors with their own children, their families. They're going on hikes and they're biking more, and they've developed creative games to play outside in the yard just to kind of get everybody moving and to get everybody out of the house from sitting around on the couch too long. So there are things you can do outside with your family. And like I say, I think just being outside and getting some fresh air can be very helpful for that.
Excellent. Yeah. Yeah. Getting outside and getting some fresh air. And I know it's getting a little colder, especially here in the Northeast, but, just taking the time to get bundled up, go for a walk, 10, 15, 20 minutes. It does have a way of clearing the air. One of the things that I used to do with my kids when they were much younger is we would put on some music and we would dance. So just dance. For some reason they really liked some of the music from Shrek. And we would just dance for one or the two songs that got people moving, and then we turned it off and went on to do homework. So
Dancing's great exercise.
yeah, so that's just dance. Other questions. Let's see. One of the things that we do like to kind of ask our guests, when you think of this COVID fatigue that we're talking about, is there any particular prayer or scripture passage that comes to mind that gives you some comfort, some support as you think about these kind of issues?
Well, I mean, actually, I try to remember, some passage each day from the breviary in my morning prayer. And I thought when I was reading it this morning, I got it right here. I thought, well, this is just from the last stanza, I think, of Psalm 108, and it says, "Give us help against the foe, for the help of man is vain. With God we shall do bravely, and He will trample down our foes." So, I mean, there's something there every day. I think there's meat in the scriptures every day, and the Psalms are a great source of the Psalms and the Gospels are a great source of consolation for me.
The Psalms and the Gospels are a great source of consolation. Excellent. One of the things that you mentioned earlier, Richard, is this whole question about not being able to see the end of the story here, not being able to see the light, if you will, at the end of the tunnel. Any thoughts about how we can deal with that issue?
Well, I think we're as Christians, we're filled with hope, and we can't forget that. So that's one of our virtues we have to count on right now is hope. And our hope is that we will get to the end of this. Things will get better. They certainly can get worse in some parts of the country before they get better, but we've got to be able to realize that with God on our side, we'll get through this, and hopefully we'll come out stronger and be better prepared for similar events in the future. That's my hope and prayer.
Right. That's right. Um, any, one of the things that is in the news is the question of opening up schools, for example, making sure that teachers are protected. Do you see any positive indications about how that might be able to happen and when?
Well, I'm not a policymaker, but I think it makes sense to kind of see what the community positivity rates and the number of cases you're having in your local area. And then if it's below a certain threshold, and again, I'm not setting policy, but it seems like we could probably figure out what a good threshold would be, and where that would allow students to attend face-to-face classes again. And in our area, a lot of the school districts have given the parents an option, and so some of the kids are attending school face-to-face, and some are staying home doing it virtually, and that's kind of helped out a little bit because the school population is less than it was, and it helps with social distancing there. And we're just, making sure they've got plenty of access to hand sanitizer at school, and we're getting them outside as much as we can too to get them out of the classroom. But I think you just got to see what what's going on in the community to decide. Like right now in El Paso would be not to be a good time to be going to school.
Right.
It needs to kind of stay home and isolate right now.
Yeah. We have to always read what's going on in our local context, and sometimes that asks us for some agility to deal with these situations. Yeah. Any final thoughts for our viewers tonight on how to manage this COVID fatigue that we all are experiencing in different ways?
Well, I think we can all ask God to help lift our burdens, with prayer. And again, take care of yourself. Make sure that you're getting plenty of rest and you're eating a healthy diet. It's kind of what I tell my teenagers all the time too. And you're not staying up too late at night. And if the things that are annoying you, whether it's news coverage or social media, you can turn that off or turn it down or back away from that for a while, and to kind of help restore yourself. Because sometimes we all need to be restored. And sometimes we need to let go of the things that are pulling us down.
Right. Yeah, I think that's really wise. Sometimes we kind of collapse into TV or looking on things online, and it would probably be better just to turn all of that off and crack open your Bible if you haven't done that for a while. One of the services that the MISSIO provides is that you can sign up for daily messages from the Holy Father. A lot of people have found that very helpful. The link has been put into the notes there. Richard, it's been really wonderful speaking with you tonight. I really appreciate it very much. You've helped us kind of get a handle on what this fatigue is and help us see that, while it's a symptom of COVID, we need to have other symptoms as well before to be worried about that. But we do need to care for ourselves through this. So I'd like to thank everyone for joining us tonight. It's been a wonderful conversation with Dr. Richard Byrd. Dr. Byrd, blessings on you and your family and your practice, on all those folks that you are caring for. Next week, we will be back for another episode. We're going to be focusing on the question of relationships as that has impacted the way we deal with this pandemic. How do we navigate this pandemic and care for our relationships? From all of us here at MISSIO, thank you for joining us tonight. We really appreciate your time and your involvement and your questions. Take care, and God bless you.